I'm pleased to be joined today on Health Beat by Dr. Jason Bailey, a podiatrist specializing in foot and ankle surgery with Faith Regional Physician Services Orthopedics in Norfolk. Dr. Bailey, you treat foot and ankle conditions for people of all ages. Explain a condition that causes heel pain for children known as Sever's disease.
Great, thanks for having me, Rob.
You bet.
So Sever's disease is a very common source of heel pain for children. We see it in all children, whether male or female, and we see it from ages, it seems to be from 8 to about age 12. And this most commonly comes about during soccer season, during football season, or baseball, when kids are wearing cleats or shoes that really aren't as supportive to play their sport. These children usually complain of significant pain in the back of the heel. The pain when they step down, pain when they're running, and pain when they're jumping. And this pain doesn't go away unless they're off the foot or if they take an anti-inflammatory pain medication. As we can see on this x-ray, if you look at the heel, you'll notice there's a line in the back of the heel. That is a growth plate. So that's where the calcaneus or the heel bone is gaining its length as that child ages. The Achilles tendon attaches to that growth plate, to the bone furthest back. And we know that a lot of us, children and us as adults, are tight a lot of times in the back of our leg, and we have to stretch to loosen up our calf muscle. Yes. What happens in children is this gets really tight and it starts pulling on that growth plate. Another medical term for this is traction apophysitis, the apophysis being the growth plate in the heel. So this can be attributed to a tight posterior muscle group in the leg, and can be treated with stretching and anti-inflammatories as well. What we commonly see, however, is by the time the patients come in, they have fairly significant pain. And in those circumstances, it's best to get the patient in a boot or in a cast. If they're in a boot, we put a heel lift in there to take some of the pressure off that tendon, and we allow that patient, allow their foot to settle down and the inflammation to go away.
I see. Very good. Well, thank you very much for that information. We appreciate it.
You're welcome.
Okay. That's Health Beat, brought to you by Faith Regional Physician Services.